hepatitis, as you know, there are different types of hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. But as far as the treatment is concerned, so we are very much concerned regarding the treatment of hepatitis B and C, because you know hepatitis A is a self-limiting disease, right? And in if there is hepatitis A, so we have to give the supportive treatment. Otherwise, the proper treatment is required for hepatitis B and hepatitis C. Several agents effective against hepatitis B and hepatitis C viral infection are now available. The important point, that is, the treatment is suppressive rather than curative. So by giving treatment, we can inhibit or avoid the complication that can develop. So this point is important. Current treatment is suppressive rather than curative. The high prevalence of these infections worldwide, with their concomitant morbidity and mortality, reflect a critical need for improved therapeutics. Okay, drugs that we use in the treatment of hepatitis B viral infection, in which we have interferon alpha 2B, pegylated interferon alpha 2A. What does it mean, pegylated? Because when we add polyethylene glycol molecule in interferon alpha, that is labeled as pegylated interferon. And the importance of addition of this polyethylene glycol in interferon, that is what is the importance? That is the important question, because it increases the half-life of interferon, so it's going to produce the persistent effect. Another drug is lamivudine. There is adefovir, entecavir, tenofovir, dalbivudine. So these are the commonly used drugs, right? So drugs for hepatitis B infection, usually in the acute attack, there is no as such treatment, but to avoid the chronic development of chronic hepatitis, we use the therapy, because already I told you the purpose of using these drugs to suppress the viral replication. So lamivudine, that is used in the chronic hepatitis B, and 100 milligram once daily, and it is given orally. There is another drug, Adefovir, chronic hepatitis, 10 milligram once daily. The route of administration is oral. Entecavir, the dose is just like other drug used in chronic hepatitis that already we have discussed, 0.5 to 1 milligram once daily, and route of administration is oral. Tenofovir, the dose is 300 milligram once daily, and it is given orally. Dalbivudine, 600 milligram once daily, and it is also given orally. So what you must remember, what are the drugs that we can use in the treatment of hepatitis B viral infection? And there is another way to ask the question, what are the orally administered drugs that can be used to treat hepatitis B viral infection? So you will say lamivudine, adefovir, entecavir, tenofovir, dalbivudine. So these are the commonly administered drugs. Then interferon alpha 2B, and the dose is 5 million units once daily, or 10 million units 3 times weekly. Route of administration, subcutaneous or intramuscular. Okay, pegylated interferon alpha 2A. And I have discussed with you what you mean by pegylated. The dose is 180 microgram once weekly, and route of administration is subcutaneous. So pegylated interferon is given subcutaneously, whereas interferon, simple interferon alpha, can be given either subcutaneously or by intramuscular route. Tenofovir and entecavir can be used orally as monotherapy, but other given drugs like telbuvudine, lamivudine, and adefovir cannot be used as monotherapy due to emergence of resistance. This concept, I think all of you know, when we use the combination therapy. The purpose of combination therapy is to avoid the emergence of resistance. This is the key point. And number two, if we use a single drug, we'll have to use the high doses. But if we use the combination of drugs, so definitely the individual drug dose can be reduced. So this is how we can also minimize the toxicity. But the main point is to avoid the emergence of resistance. This is the key point. So tenofovir and entecavir can be used as a monotherapy, but the other drugs cannot be used as monotherapy. They must be used in combination therapy. Clear? This is a important point. Okay. Okay. Now the drugs for hepatitis C, infection, pegylated interferon alpha 2A, and again in the treatment of chronic hepatitis, there is only one exception where we can treat acute phase of infection. In the last, you can see interferon alpha 2b that can be used in the treatment of acute hepatitis C. But the concept is there. Usually, we suppress the further multiplication of the virus. So generally, we use the drug uh, in the treatment of chronic hepatitis. So pegylated interferon alpha 2A, 180 microgram once weekly with or without ribavirin. So this is important. Okay, in the treatment of hepatitis B, you must remember what are the oral drugs. We have lamivudine, adefovir, entecavir, tenofovir, telbuvudine, and what is the other important point that you must remember? That tenofovir and entecavir that can be used as monotherapy. Other drugs cannot, right? So similarly, this ribavirin is the oral drug that can be used in the treatment of hepatitis C. And very interesting point, there are several other drugs that can also be used orally in the treatment of hepatitis C that we will discuss later on. But first, pegylated interferon alpha 2A that is given subcutaneously. So important point that already we have discussed. Simple interferon can be given subcutaneously or intramuscularly, but pegylated interferon that is given subcutaneously. This is important point. Now, pegylated interferon alpha 2b and 1.5 microgram per kilogram once weekly with ribavirin, right? Or 1 microgram per kilogram once weekly as monotherapy. So it can be used as monotherapy as well as the combination. It depends, it depends on the viral burden, and it depends on the decision of the consultant, concerned authority, concerned physician, Okay, this patient should start the therapy with only pegylated interferon, or this patient should be started the combination therapy, right? And it depends on the viral burden, right? So, okay, Ribavirin, this is the drug, this is the older drug that can be used in the treatment of hepatitis C, and 800 to 1200 milligram daily according to weight and prognosis, right? Now this point is clear, according to weight and prognosis, and the route of administration is oral. Okay, interferon alpha 2b. This is the preparation. This is the preparation that we can use in the treatment of acute hepatitis C, and 5 million units once daily for 3 to 4 weeks, then 5 million units 3 times weekly. And as already we have discussed, because this is the simple interferon, so it can be given either subcutaneously or intramuscularly. There is another preparation, and interferon alpha 2A, and that is again in the treatment of chronic hepatitis C, 3 million units 3 times weekly, and either given subcutaneously or intramuscularly. Interferon alpha 2B, chronic hepatitis C, 3 million units 3 times weekly, just like interferon alpha 2A, either given subcutaneously or intramuscularly. There is another preparation, interferon alpha cont 1, and 9 to 15 microgram 3 times weekly as monotherapy. And the route of administration is subcutaneous. Here you can see this is the preparation, interferon alpha cont 1, just like pegylated interferon, only be given subcutaneously. Okay, now there are in the current scenario, treatment scenario, there are a number of drugs. There are number of drugs that can be given orally in the treatment of hepatitis C, and there are few examples that I am sharing with you. That is, you can see there is a drug that is the Velpatasvir, Sofosbuvir, Elbasvir, Grazoprevir, Daclatasvir. So these are the currently available drugs that can be used in the treatment of hepatitis C, and that can be given orally. There are other examples as well, right? So, but these are the examples that at least we must know, right? So again, to avoid the resistance phenomena, we usually give the combination of oral drugs in the treatment of hepatitis C, like velpatasvir plus sofosbuvir. So in our clinical setup, this sofosbuvir is being used extensively, right? So the combination, velpatasvir plus sofosbuvir, 100 milligram of velpatasvir and 400 milligram of sofosbuvir once daily. Okay, one interesting point, the duration of treatment. Usually the duration of the treatment is the 12 weeks duration, right? So this is important. So there is another combination. This another important point. This surface bower can be used as monotherapy, but again, the logical point that I want to share with you, it depends. It depends on the viral burden, patient response. This is important because sometimes monotherapy would be ineffective, and that would show the emergence of resistance. So in that situation, we use the combination. But another important point, when we use the combination, increased chances of side effects. So this is the decision that would be taken by the concerned physician. Okay, this patient should start as monotherapy, or should start the therapy with combination therapy. Sometimes monotherapy is started if patient is not responding, so we can add another drug. Clear? So another combination, Elbesvir plus Grazoprevir, uh, 50 milligram for Elbesvir, and 100 milligram for Grasoprevir. So the purpose of mentioning these names that you will be familiarized that these are the latest preparations that we are using in the treatment of hepatitis C, right? So another Declatisvir plus Sofosbuvir, 60 milligram of uh, Declarisvir, and again, just like Sofosbuvir, the standard dose is the 400 milligram once daily. So individually, if we say that there is a Velpatasvir, Sofosbuvir, Elbesvir, Grasoprevir, and Declarisvir, Sofosbuvir, right? So these are the drugs that we use in the treatment of hepatitis C, and that is given orally. Okay, there is another Samipravir along with Sofosbuvir. So you can see these of Ribavirin, which is the most important drug in our current clinical setup in the treatment of hepatitis C, that is Sofosbuvir, right? So Samipravir plus Sofosbuvir, 150 milligram of Samipravir and 400 milligram of Sofosbuvir, and it is given orally, and the duration of treatment already I told you would be the 12 week. There is another hepatitis C drug, Paritrapivir plus ritonavir plus ombitesavir plus ribavirin. So in which situation we are going to use the combination of these four drugs? That means when there is a heavy burden, and if patient is not responding with monotherapy and the combination of two drugs, then we will use these combination of four drugs. So this is the general conceptual point. Okay, we are not going to start the therapy with four drugs, right? Because this is against the patient compliance, because this is clinically, this is very important, because you are going to start the therapy with four drugs, but if patient is not is cooperating and reluctant to take the combination of four drugs, so this is uh, depends on the conversation, how you are going to convince patient. This is another very important part. Okay, now you are required the combination of these four drugs, and life is more important than side effects, then they are convinced to take these preparations. Clear? So Paritrapivir, 150 milligram, 100 milligram is the original with 25 milligram is ombitesavir, and 800 to 1000 milligram of ribavirin. That is the standard dose of ribavirin, because ribavirin is one of the oldest drug that is given orally in the treatment of hepatitis C. But nowadays, some patients they are showing the resistance, so that is why the new Previr family that we are trying, like Samipravir, Sofosbuvir, Paritaprevir, right, and then the previous Elbesvir, Grasoprevir. So these are the new products, right? Okay, this is an important slide because the major problem related to the drugs, especially the drugs that we use in the treatment of hepatitis B virus infection, or if we are using interferon, because dose adjustment in renal insufficiency, because these are the drugs mainly eliminated through kidneys. So renal function should be checked properly, right? Like Lamivudine, Adefovir, Entecavir, Tenofovir, Talbuvudine, interferon alpha 2A, interferon alpha 2B, pegylated interferons. So before starting the therapy, we must check the renal status, and even in during the therapy, we must check the renal status. Now, one by one, we discussed the individual drug. So already we have discussed the key points treatment of hepatitis B and C. So at least at this level, you must know, you must be aware, that what are the combination of these drugs, right? So these are the that these are the drugs that we are using, right? And when this problem is always going to over, inshallah, the this corona problem, so after that problem, you can go to the ward, and because fortunately we have a separate ward, right, Niljit? So we where you can check yourself, okay, what are the drugs that we are using in our clinical setup. When you know at least the name of drugs, if you are familiar with the drugs, so it will be easier for you to correlate the points. Clear? So, okay, interferon mechanism of action. This is one of the important group. Interferon basically is a cytokine, right? And the mechanism, and this acts through host cell surface receptor, increasing the activity of Janus kinases. So this is one of the enzymes family. Okay. So these enzymes, after stimulation, right? These enzymes phosphorylate signal transducers and activators of transcription, right? That is in short called stats, to increase the formation of antiviral proteins. Clear? So after stimulation of Janus kinases enzyme family. So these enzymes, they are phosphorylate, signal transducers, and activators of transcription to increase the formation of antiviral protein. The selective antiviral action of interferon is primarily due to the activation of a host cell ribonuclease that preferentially degrades viral messenger RNA. And interferon also promotes formation of natural killer cells that destroy infected liver cells. Clear? Pharmacokinetics, because we have to focus on the pharmacological point of view. So pharmacokinetics, that you must know, mechanism of action. Now pharmacokinetics. So there are several forms of interferon that already we have discussed in the previous slides, with minor differences in amino acid composition. Absorption from intramuscular or subcutaneous injection is slow. Elimination of interferon is mainly via proteolytic hydrolysis in the kidney. So that is why if a patient is on any type of preparation of interferon, we must check the kidney status, because if the renal function is compromised, so this drug is not going to be eliminated properly. So it may further damage the kidney. Conventional forms of interferon are usually administered forms that already we have discussed, pegylated forms of interferon conjugated to polyethylene glycol, and that can be administered once a week, right? So this is the key point, because two important advantages of pegylated form. Number one, we can avoid the multiple dosing, right? And number two, it uh, increases the half-life of that drug, so the persistent effect can be produced, right? But its pegylated form is expensive if we compare with the simple interferon. Clear? So clinical uses: interferon is used in chronic hepatitis B viral infection as an individual agent or in combination with other drugs. Usually we use the oral drugs, right, as adjuvant drug along with interferon, and the oral drugs already we have discussed. When used in combination with ribavirin, the progression of acute hepatitis C viral infection to chronic hepatitis C viral infection is reduced, right? And there is no need to confuse about, because interferons preparations we are using in the treatment of hepatitis B viral infection as well as in the treatment of hepatitis C viral infection. In the previous slide, already we have discussed. And ribavirin, this point also we have discussed. This is the oldest drug that we use along with interferon in the treatment of hepatitis C viral infection. Pegylated interferon together with ribavirin is superior to a standard form of interferon in chronic hepatitis C viral infection. Because in our setup, we prescribe the therapy on the basis of patient status as well, financial status as well. This is important because we are not going to cover the financial burden. So patient himself or herself has to bear or tolerate the expenses, right? So this is very important point. So ideally patient should be started with pegylated interferon, but if patient is not affording, right, so either we arrange the pegylated form for that patient, so we cannot arrange for each and every patient. So in that situation, at least we start the therapy with interferon, simple interferon, and other oral therapy. So this is the very important clinical point and uh, logical point, right, towards the treatment of hepatitis B or C infection. Toxicity, in the general, we talk about regarding interferon, GI irritation, a flu-like syndrome, neutropenia. This is important side effect that will have to be very, very careful. So how we can monitor by prescribing or by recommending the periodic monitoring of blood CP. Profound fatigue and myalgia. This is very important side effect. Alopecia, reversible hearing loss, thyroid dysfunction, mental confusion, and severe depression. So a lot of studies have been done, right? And you can check it. So if a patient is on interferon therapy, what is the role of antidepressant? So a lot of studies has been done, and if a patient is on interferon, we can add antidepressant to avoid this problem like mental confusion and depression. So this is another very important clinical point. Contraindications, right? Contraindications, there are some conditions in which it is better not to give interferon, rather will have to try other combination of drug, like if a patient having autoimmune disease, history of cardiac arrhythmias, and very important is pregnancy. So these are the important contraindications. So another very important drug, that is the Adefovir, and this is basically the drug that can be used in the treatment of hepatitis B viral infection. And mechanism of action: Adefovir Dipivoxil is the prodrug of Adefovir. Its phosphorylation by cellular kinases competitively inhibits hepatitis B viral DNA polymerase, results in chain termination after incorporation into the viral DNA. Hepatitis B viral resistance to Adefovir, though uncommon, has recently been reported. So it's very effective drug, but nowadays it's showing the resistance. Pharmacokinetics and clinical use: Adefovir has good oral bioavailability and unaffected by foods, right? This is very important point, and so that is why Adefovir is being used. The drug is eliminated by the kidney, and dose reductions are required in renal dysfunction. This point already we have discussed. Adefovir has activity against lamivudine resistant strain of hepatitis B viral infection. This lamivudine is another orally administered drug against the treatment of hepatitis B viral infection. If patient is showing the resistance against lamivudine, so we can try the drug that is Adefovir. Toxicity of Adefovir: nephrotoxicity is dose limiting. So already we have discussed this point. If the renal function is compromised, we'll have to calculate the dose accordingly, right? Because if there is an increasing dose, it can damage the kidney further. Lactic acidosis and severe hepatomegaly with steatosis may also occur. Okay, because initially we are discussing the important drug, right? Like Adefovir or Entecavir. This is another very important drug that is being used. Entecavir is a guanosine nucleoside that inhibits hepatitis B viral DNA polymerase. Effective orally, the drug has an intracellular half-life of more than 12 hours. Renal elimination in part via active tubular secretion. When we say the drug is eliminated through kidney, the most of the drugs eliminated through kidney, the main mechanism is the tubular, two important mechanism: glomerular filtration, and the next one is the tubular secretion. So generally, most of the drugs follow the glomerular filtration, but some drugs follow the tubular secretion, and some drugs follow both routes. Okay, so renal elimination in part via active tubular secretion. That means this is the drug not only filtered through glomerular filtration, but also secrete out through active tubular secretion. Clinical efficacy is similar to that of lamivudine. There is cross-resistance between the two drugs, right? So the drug causes headache, dizziness, fatigue, and nausea. When the drugs showing the cross-resistance, so it is better not to give the combination of these drugs. This is another important point. Now this lamivudine, just like ribavirin, as I told you, in the treatment of hepatitis C, one of the oldest drug is the ribavirin that is given orally, right? And just like lamivudine, that is the older drug in the treatment of hepatitis B viral infection. But nowadays, this lamivudine showing the resistance. So that is why we are preferring Adefovir and Entecavir. This lamivudine is nucleoside inhibitor of HIV reverse transcriptase, is active in chronic hepatitis B viral infection, has a longer intracellular half-life in hepatitis B viral infected cells than in HIV infected cells. So what is the important point in this line? Because this can be used in lower doses for hepatitis than for HIV infection, because in hepatitis B viral infected cell, it has a longer intracellular half-life. So low doses are required if we compare with the doses which are required in the treatment of HIV infection. Used as monotherapy, lamivudine rapidly suppresses hepatitis B viral replication and is remarkably non-toxic. So that was the reason of using this drug lamivudine commonly. But nowadays, this lamivudine, because of its extensive use, may showing the resistance. Co-infection with HIV may increase the risk of pancreatitis, right? So lamivudine resistant. Now you can see lamivudine resistant hepatitis B viral mutant emerge at a rate of about 20% per year if the drug is used alone. On reappearance of detectable levels of hepatitis B viral DNA, patients should be switched to interferon or adefovir. Now, ribavirin, because this is the important drug as far as the hepatitis C treatment is concerned. This is one of the keys of action. Ribavirin inhibits the replication of a wide range of DNA and RNA viruses, right? Including influenza A and B, parainfluenza, respiratory syncytial virus, paramoxyvirus, hepatitis C virus, and as well as in the uh, treatment of HIV, right? Although the precise antiviral mechanism of ribavirin is not known, the drug inhibits guanosine triphosphate formation and prevents capping of viral messenger RNA and can block RNA-dependent RNA polymerase. Pharmacokinetics and clinical uses. Ribavirin is effective orally, So avoid antacids because antacids interfere its absorption. Also available in intravenous and aerosolic forms, it is eliminated by the kidney. So that is why dose adjustment is necessary if the renal function is not normal. Ribavirin is used in intravenous administration alone is not effective. This is important point. Just like in the treatment of hepatitis B, the Lamivudine, but this ribavirin in the treatment of hepatitis C, we are not going to use this ribavirin as monotherapy. Clear? Always given with interferon, right? Toxicity, systemic use results in dose-dependent hemolytic anemia. This is important side effects from the exam point of view. Aerosol ribavirin may cause conjunctival and bronchial irritation. Ribavirin is a known human teratogen, absolutely contraindicated in pregnancy. Tenofovir, that is basically antiretroviral drug and also approved for chronic hepatitis B viral infection, active against lamivudine and anticoagulation resistant strains. So that means this is another new drug that can be used in the treatment of hepatitis B viral infection, right? So the if we say regarding hepatitis B viral infection, and already now back to the chart. This orally we have lamivudine, adefovir, entecavir, tenofovir, right, talbuvudine, right. So these are the oral drugs that can be used in the treatment of hepatitis B, and already we have discussed the important points regarding these drugs. And then hepatitis C, we have the key important oral drug is the ribavirin, and the now the new oral drugs that already we have discussed, that is the valpatisivir, right, and the sofosbuvir. This is very important drug that is being used commonly in our clinical setup. And basically these drugs like daclatasivir, albesvir, ladipasvir, ombitasvir, valpatisivir. So these are basically nucleoside 5A proteins, right? And basically these drugs that inhibits the nucleoside 5A proteins that plays a role in both viral replication and assembly of the hepatitis C viral infection, right? So what is the important point that at least you must remember at this level? These drugs, daclatasivir, albesvir, right, ladipasvir, ombitasvir, valpatisvir. So these are the inhibitor of nucleoside 5A proteins, and these proteins basically play a vital role in viral replication and the assembly. When we inhibit these proteins, so we can inhibit the replication and assembling of hepatitis C viral infection, right? So there are another drugs like dasabovir, and very important drug that is the sofosbuvir, and these drugs basically inhibit the nucleoside 5p RNA dependent RNA polymerase, because these are the protein that involve in post-translational processing that is necessary for replication of hepatitis C viral infection. And sofosbuvir and dasabovir, right? So there is another drug that already we have mentioned, like important example is the Grassoprovir, and in the another slide, that is the paritaprevir, right? and Samipravir. So these are the examples, and these are the drugs that inhibit nucleoside 3 or 4A proteins inhibition, right? So these are the important points that at least you must remember at this level, right? I think if you remember or memorize these important points, that would be enough for you as far as the important points are concerned regarding exam. Okay, thank you so much. Okay, can we leave now? Okay, thank you.